And here to talk about this new test is Dr. Kerry. He's the chair of the Department of Obstetrics and Gynecology at Howard University Hospital. Doctor, thanks for being with us tonight.
It's a pleasure. Thank you for
This
asking.
really is a breakthrough for some couples. We know doctors in Great Britain are already using the test on fetuses that are at risk of having hemophilia or other gender-related diseases, kind of a way to guide treatment decisions.
Right.
So this really isn't about just choosing paint colors, right?
No, that's correct. This really isn't. I think what's really revolutionized the technology is the ability to identify what the gender is of the fetus prior to our ultrasound diagnosis. Now, even with the ultrasound diagnosis, we are sometimes in error, but the ability to identify early in pregnancy and then to give the patients the opportunity to make those really life-altering decisions early enough in gestation has really revolutionized how we manage these potentially high-risk pregnancies.
How does this work? It's a simple blood test you do at home?
Well, it's based upon, no, it probably can be done at home, but really what it is, it's something that we've known for many, many years. Back in the 1940s, we realized that there was a physiologic event that occurs in every pregnancy. That is fetal red blood cells, fetal blood cells, or fetal cells getting into maternal circulation. So we know that always happened. And about the last part of pregnancy, about 75% of pregnant women will show evidence fetal cells are in their own maternal circulation. So the ability to identify those cells early in pregnancy that are already in maternal circulation gives us the opportunity to then give them the sex of the child, particularly if it's a male, and then be able to counsel them, particularly if there's genetic disorders related to it being a male fetus, so that it allows them to be adequately counseled and to make those decisions based upon having that information early in pregnancy, so they don't have to wait till later on in pregnancy to make those decisions.
But there are questions coming up about this test. The studies that have been done on these kind of testing are raising concerns that couples are using them for gender selection and abortion. Is that true? Is that what you're finding? And what's your thought about that?
Well, I think that when I was first made aware of this, that definitely was a question that I myself asked, the question regarding whether or not patients would have the opportunity to then make gender selection. Now, one thing we have to understand about the test only is really able to tell if it's a male fetus. What that means is that the test has shown, given a number of studies, that it has a 95.4% sensitivity. What that means is that if the test does not show that it's a male, that means 95% of the time it's going to be a female, which means 5% of the time you either can't tell what the sex is or that it actually is a male. So it does have some limitations as far as the information that can be gathered from it.
Okay. Let me ask you about this, though. There's a company out of California that sells the kits. They won't test the blood samples unless a woman signs a consent form agreeing not to use the results for gender selection. Do we need to have more controls on these tests to be sure people aren't using it for gender selection?
Well, I think given the early indications of the use of this test, the fact that this is relatively new technology, the fact that we don't really know how to handle these tests as it relates to person's individual and cultural-based decision-making, I think that it's very important that the patients are adequately counseled and that we understand why they have this doesn't know the gender. There are definitely medical indications, there are genetic disorders that are definitely carried in the male fetus, and therefore it's very important to have that information early so that the patient can be adequately counseled. So it's difficult to say that, well, you know, we shouldn't do the test because we're not sure that they're going to do gender selection, because there definitely are medical indications. However, I think that is a very valid point that needs to be discussed with the patient and needs to be assessed in some way so that we don't get into that scenario in which we're doing gender selection, because I think that could be a very dangerous road to go down.
Could this potentially lead to fewer abortions, though? Once you know the gender, you bond with your baby, it personalizes the pregnancy. Is that a possibility?
Well, I think it's always a possibility. I think once you know the gender of the fetus, I think it really does help you bond. Even when we do ultrasounds and identify it as a male or female, I think there's an immediate bond to the gender of that baby. And I think in that respect, it probably does have an impact as far as making the patient pause as it relates to any potential intervention that may be associated with doing termination of the pregnancies.
Lots of ramifications here, lots of sides to this, and certainly a breakthrough. Doctor, thanks for being with us tonight. We really appreciate it.
No, my pleasure.
All right, we'll be right back.